some of the challenges in the healthcare industry. We've poised ourselves and we've taken on a Herculean task of going back to school as adults for about a year for some of us. And I know it wasn't easy, but it was for a reason. It was for a reason because today in this room, we have a new generation of change agents, a new generation of leaders in healthcare that are going to help make a difference in our dear country. So may I join the board and congratulate all of you in advance on your graduation today and the formation of your alumni association. We must celebrate our own, and against all the odds, you are the ones that are raising the bar for healthcare. Now, as you're raising this bar and you're going to make a difference, you're poising yourselves for the challenges ahead of you, it's important that we realize where we are coming from. There are certain things that we're proud of in our country, but healthcare doesn't seem to be always in that top box. We're a country where healthcare is only contributing less than 2% of the GDP. A country where we have some of the worst statistics and indices, outcomes, especially when it comes to maternal and child death. That every day we lose at least 10 women that could have been prevented if we had the right things in place. That we are at par with certain countries that are war-ravaged, like Afghanistan, like Sudan, when it comes to nutrition. These are not things that we are proud of, but it's the reality. Where 61% of our births are still attended to by unskilled attendants. Where infrastructure is dilapidated and financial budgets are limited. And when we do have the budgets, as you're aware, for those of you in the public sector, over 90 to 95% of that is spent on recurrent expenditure. We know that the IFC said that $10 to $15 billion is required to change the infrastructure in our country. So there are lots of tasks ahead of us. We have people who are paying for healthcare out of pocket with only a 6% coverage of insurance, which means for every time that our patients get sick, we start this vicious cycle of poverty. This is something that we in this room have to help to break. We also have challenges with regulation, sometimes over-regulation, sometimes under-regulation. For those of us in the private sector, we also complain about multiple taxation. On top of that, this is ridiculed with a challenge of a shortage between healthcare workers and patients, especially when it comes to doctors. The last time we checked, there are less than 75,000 doctors registered on the Nigerian Medical and Dental Council. Of that, I'm told, more than half of them are part of the brain drain. They left the shores to go to Saudi Arabia, and now they're also in the UK and the US. There are more doctors in the US that are consultants than there are in our own country. These are some of the tasks that, unfortunately, that we have to face, but we are poised to do. For me, one of the most painful points is the fact that not only are we losing our doctors, people like yourselves in this room, but we're also exporting our patients. We're losing $1 billion every year on exporting our patients that are looking for or perceived access to quality healthcare. Now, with all these Herculean challenges, it looks like the task ahead of us is not possible. But I'd like to say the opposite. For me, I see challenges as an opportunity. How do we use the skill sets, the knowledge, the wisdom, the leadership skill sets, the governance that we have learned in the last year? How do we use that experience now to change the name of the game for healthcare? How do we put a smile back on people's faces? How do we get perception for poor quality in our country back? The answer is in this room. You in this room are the shining stars. You are the hope for the new generation. You are the people that will make and change the name of the game. But it will not be an easy thing. With what you've learned, you will be doing what we call paradigm shifts. And it starts by first a positive attitude. You've learned the importance of ethics in practice. You have also inculcated the importance of hard work. This is what you will need to do to invite the same things you've learned in your own workforce. You and I know one of the things that brings us down is that healthcare has lost something that's very important to us, which is empathy. The attitude sometimes to healthcare, to patients, is not where it should be. So we need to get that right. You've broken the status quo. You've been able to now help to shape the new ways in which we can do things. Now, how is this going to happen? It can happen by various things. And to start off with, I think it starts with leadership. The fact that we have and we understand the importance of professionalism, of upholding ethics in the practice, where people do not get commissions for referrals, but we do referrals because it is part of what we swore in the Hippocratic Oath. That we share empathy, that we share compassion, that we teach and inculcate it, that we understand that it is not access to healthcare, but it is access to affordable, quality, sustainable healthcare. And to be able to do this, we have to become more of listeners, listening more to our patients, what is required, and becoming more doers. We have to have a vision, now that we are no longer students, have a clear vision of what we want to achieve in our various hospitals. How are we going to do it? Identify amongst your team members, people that can join you as change agents, and replicate, do train the trainer, replicate what you know in others. Have those objectives and determine short, medium, and long-term objectives. We have to think out of the box. It cannot be business as usual. We need what I would call positive disruption or disruptive innovation. Innovation does not mean doing things grand in a different way. It means doing things you normally do with a slight difference that becomes more efficacious, more efficient. For example, do you have to procure every single piece of equipment in your organization? Or can you use the negotiation skills that you've learned to negotiate for leases? Can you use a little bit of your IGR and put as a down payment and be able to access and have access to equipment, improve your infrastructure, not necessarily by the normal cause or normal ways of procurement? What can you do in terms of quality? Should we just take the minimum quality set by government? Or can we think out of the box and take what JCI, COSASA, and any of the other quality standards that are used in the world? Can we take clinical governance to the right level? Can we take infection control to the right level? Can we think of the next generation of how we're going to be able to change the name of the game? Disruptive thinking is something that we've learned. Disruptive innovation is what we require. The disruptors are in this room. You are the change agents that we are waiting for. Can you please give yourselves a round of applause? Now, to do that, there are a couple of things that we can take in mind. And one of them is leveraging on technology. Technology, I don't mean big CT scans and MRI, and that's coming from somebody that sells them. I'm thinking about what can you do with a mobile phone. We have 150 million Nigerians that are using a mobile phone. I'm told that over 60-70% of Nigerians access the internet through that mobile device. What can we in this room, either as a hospital or as a cohort, as the alumni of 2017, what can we do to be able to do a link between the patients who have a phone and we in the hospital? Can we think of joining them? Can we do health education, health awareness, reach out programs? What can we do? But it cannot be business as usual. I don't have all the answers today, but I know that the answers are in these two classes, and that together we can do great things. Quality is where I'd like to end this conversation. We can't overemphasize the importance of quality. We have learned a lot on leadership and governance, but that is gearing towards the access and provision of quality healthcare. And I use a simple acronym called EASE to say what I mean when it comes to quality. EASE as E-A-S-E. First, about efficiency. Second, about effectiveness. Also about accessibility, about affordability, about acceptable services. When I say all these things, it is if you are on the other end, sitting in front of the consultant's table, what do you want as a service? If we start with what we want as a patient, we can pass this same thing on. So patient centricity, for me, is at the beginning and at the end of quality. If we take this in mind, we can get equitable services. We can work along the whole value chain from primary, secondary to tertiary care. It is important that we start to do some kind of quality control, quality assurance, that we go beyond the minimum standards recommended by government, that we do self-accreditation, we become the beacon for quality in our country. It is a shame that we are exporting patients today to go to Ghana to do radiotherapy. It is a shame that we don't have the facilities in our country, but we can. But the challenge really is not necessarily just the facilities. It is the fact that our patients today are not primed as to the new forms of diseases that are affecting us. It is not just HIV, tuberculosis, and malaria. I'm not belittling those diseases. But the fact that non-communicable diseases are killing more Nigerians. Our age, life expectancy in Nigeria, I'm told is 57. But in the last 3 weeks, I know at least 3 people who have passed on in their 30s. So today, our challenges as leaders are not the challenges of 10, 20 years ago, 30, 40 years ago when we finished medical school. But you in this room are in a position to change the name of the game, to understand that you are transformers, that we need to transform healthcare from our practices, from our policies, from everything that we do on a daily basis to make sure that the patient is empowered with information. They are more aware, that we do more preventive healthcare programs. We do reach out programs to our various communities. We don't wait for patients to walk in. We invite them when they're healthy, do blood pressure checks, do all the basic things that we know. But ladies and gentlemen, I think that today is a day in history, that we in healthcare have a new crop of change agents, a new crop of leaders who are going to make a difference. I congratulate the Health Leadership Academy for this fantastic initiative and this second graduation of leaders like yourselves. The Healthcare Federation is a private sector umbrella body of all the players in the private sector. And we believe that one opportunity is for public-private partnership. Government cannot change healthcare in our country alone, and neither can the private sector. But together, through public-private partnerships, through innovation, through disruptive thinking, through transformation, we can make a difference. I wish you all the best in your future endeavors and the Herculean task ahead of you. And we're here to support you in whatever way we can. Thank you very much.